About 9 in 10 people who have cardiac arrest outside the hospital die, but CPR can help improve those odds. If it's performed in the first few minutes of cardiac arrest, CPR can double or triple a person's chance of survival. The current CPR guidelines focus more on chest compressions to keep blood moving to prevent brain damage rather than delivering rescue breaths. And here to discuss this topic in greater detail is Dr. Paula Walker-King. So nice for you to be here.
Thank you. Great to be here too.
So let's start with, if an adult person becomes unresponsive, what are the first steps you should do?
All right. So if an adult person becomes unresponsive, you want to follow what's known as the 3 C's. Number 1, check to make sure they're truly unresponsive. Shake them and shout. Are you all right? Are you okay? You may try rubbing the knuckles across the breastbone or sternum, and sometimes that will arouse. If there's still no response, call 911. Either you call 911 or you have a bystander call 911.
Okay.
And then 3, you begin chest compressions. And so you put your dominant hand, the heel of your dominant hand in the center of the chest, clasp the other hand on top, keep your elbows straight.
Have to stand up to do this.
Yep. And you're keeping the elbows straight and locked, and you're pushing down, right?
Okay.
So at least 2 inches down in depth, and 100 compressions a minute.
Wow.
Wow.
Okay, and you were saying to help you do that is pretty much the song Staying Alive, right?
Staying Alive. So to make sure you're doing 100, you say, ha, 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 staying alive, staying alive, ha, 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 staying alive, staying alive.
Wow.
And that keeps you on track. Now, if there's another bystander nearby, you can ask them to help you with the compressions, because it can be tiring, as you just witnessed doing that. But literally you double and triple and almost triple the person's chance of surviving.
Okay, what I noticed differently is now you don't have to do the breaths.
You don't have to do the rescue breaths. And so that was a little intimidating and daunting for most lay bystanders. And so here you just do the chest compressions, and it is sufficient. So we want to encourage people, don't be afraid to try it, because doing something is better than doing nothing. Guaranteed, if a person has a sudden cardiac arrest, they are going to die if you don't intervene. And so if you do the chest compressions, you at least give them a fighting chance.
Really, really quickly, can a person be held responsible for doing?
Great question. There are Good Samaritan laws in every state, and so if a person intervenes during an emergency, they are protected. And they won't assume any liability.
Okay, that's great information. Thank you so much,
You're welcome.
Dr. Paula.